Dr. Irshad Ali Shaikh, he's a medical doctor and the health security lead at the World Health Organization in Turkey. He joins me now in Ankara. Thank you, doctor, for joining us here on the program. I want to talk first about the measures that Turkey has taken to try to control the virus. Most recently, we've seen a curfew for people over the age of 65. We've seen barbershops close, bars and other measures. Are they going far enough?
I think, as you rightly said at the start of the program, the bottleneck in other countries has been testing, and Turkey seems to be ahead of the curve on testing. So knowing who is infected and containing them, isolating them, quarantining their contacts, educating them that if they are symptomatic, go for further testing. That is the cornerstone of containment and mitigation for coronavirus based on all other experience that we are seeing from other countries. And you rightly showed the president kindly himself there. So whole of government approach is there also. I think one factor we need to look at is whole of society that needs to follow, understand that this is a very serious, invisible thing. Though you may not be affected, your close friends, family member may not yet be affected, but you would not know when you will be affected. So observing the curfew, looking at those who are at high risk, and critically, the compliance with the social distancing measures is what will make and prevent Turkey from following the Italy pathway.
Right. You talk about how critical it is to follow these measures to contain the virus. So what more can be done to encourage people to heed the warnings about the virus?
I think it's society. We are a country of 81 million and over 80 provinces. So it really requires intensive grassroots social periphery gatekeepers in the community. So we really can further stretch the information looking at the gatekeepers, different populations, who they believe in, their local leaders. So the curfew information and social distancing really needs to come top down but bottom up. So reaching the social periphery grassroots of the country would really make the difference in educating people, along with the message that if we do not do this, what can be there? And again, you just mentioned 21 deaths already out of about 1,000. So we are slowly, but it seems like moving forward. There are many countries which have managed to stave off even under 1,000 to contain this virus. But there is a very slippery slope and a razor thin margin between where we are and where to follow the Turkey, Spain, Germany, and US path. So this is the time when whole of society, whole of government needs to come together and have everyone an all for one for all approach to say, you can prevent me and I can prevent you from getting this virus. That is what is required.
Right. So just to be clear, so we can hound this home for people who are watching this right now, how effective are these social distancing and isolation measures in containing COVID-19? So for people who know that they are making a difference.
So I think that's a great question, and thank you for asking. Over 60, 70 countries out of 171 have still the load under 100. How they have done it? Contained and mitigation, informing the people, social distancing. So we need to understand that we can infect without knowing. Again, there is data from China that 4 out of 5 people who were infected from the one who did not know they were infected. So we do not know if we are infected because we can have either no symptoms or very mild symptoms. So we can infect our loved ones, our elderly parents, our people who are we taking care of, our dependents. Children can pass on to parents. So again, this is a time when everybody needs to understand that as strict social distancing I can do to prevent the person next to me, this is what is required. Staying home, barring non-essential trips outside, making sure that we are trying to be keeping distance. If a person, first thing is, if the person gets sick within the household or loved ones, making sure that he or seeks care. And if the healthcare provider thinks the test is required, having them tested so that they are isolated if positive, making sure the quarantine close contacts. So those are, again, a collective implementation of these measures from the person who is sitting healthy today, but try to understand you may be infected, you do not know. So as much social distancing you can keep. But of course, we have to live within a household. But within a household is that if anybody shows symptoms of, and it's very clear, coughing, fever, sneezing, runny nose, all those symptoms that we can take for minor flu, it's better to approach a healthcare provider rather than presume it's flu or a routine cold.
All right, Dr. Irshad Ali Shaikh, thank you so much for some very, very helpful information there.